Hi everyone, my name is Matt Simpson and I'm a family doctor with the University of Colorado. I'm coming to you today to talk with you about the new recommendation to wear a cloth mask in public settings. Our team here at the University of Colorado is dedicated to trying to provide you with the most trustworthy and reliable information about the COVID-19 outbreak in Colorado. We know that these times can be difficult and stressful to everyone, and we hope that through these videos we can help to provide support and guidance to all of you, and that together we can get through this outbreak. Now, before we start talking about the actual use of masks, I want to just review very quickly how we think the novel coronavirus spreads. The main way in which it spreads from person to person is through something called respiratory droplets. These are small, usually invisible, particles of our respiratory secretions. Think our snot, our spit, our phlegm, all the gross stuff that comes out of our mouth and nose whenever we cough, sneeze, or even talk, breathe, and laugh. Now, if a person is infected with the novel coronavirus, that virus can hitch a ride on these droplets, and if those droplets find a susceptible person, then that person may become infected with the novel coronavirus. It's important to note that we think that respiratory droplets do not travel much farther than 6 feet before they either evaporate or fall to the ground, and that is the reason why we have the recommendation to maintain a distance of 6 feet between ourselves and other people. Now, I just want to briefly mention that there is some concern that the novel coronavirus can spread through contact. This occurs whenever a person touches a surface contaminated with the virus and then touches their eyes, nose, or mouth, thereby introducing the virus into their body and potentially causing an infection. Scientists are looking into other possible ways in which the virus can spread, but as of right now, we think these are the primary methods in which the virus spreads. To help slow the spread of the novel coronavirus in Colorado, there are several key things that you can do. Now, these recommendations include actions that you can take to help prevent yourself from becoming infected, as well as actions that you can take to help from infecting other people. These recommendations include things such as staying home whenever possible, especially if you are sick, washing your hands frequently, avoiding touching your face, in particular your eyes, nose, and mouth, with unwashed hands, cleaning high contact surfaces in your house with standard household cleaners, maintaining a distance of 6 feet between you and others whenever you do go out in public, and now with the newest recommendation, wear a cloth mask or covering whenever you go out in public. There are two main types of masks. The first are medical masks, such as this one, that include surgical masks as well as N95 respirators. The other are non-medical masks, such as this cloth mask and other cloth coverings that we're being asked to put on our face when we go into public settings. Previous research has shown that medical masks are better than cloth masks at preventing the person who is wearing the mask from becoming infected. Because of that, we recommend saving medical masks for use by healthcare workers who are in direct contact with sick patients. Now you might be wondering, if a cloth mask isn't as good at preventing me from becoming infected, why am I being asked to wear one all of a sudden? Let me explain. With the novel coronavirus, we're learning that people can become infected who don't have symptoms such as a cough, fever, or sneezing. Because of that, they're at risk of spreading the virus through respiratory droplets that come out of their mouth whenever they talk, breathe, or laugh with their friends and neighbors. While maintaining a 6-foot distance between yourself and others is still one of the best ways to prevent you from spreading the virus, adding on a mask, particularly when you're in a public setting where you can't always keep that distance, is a new recommendation. The thought is that the cloth mask may prevent some of the respiratory droplets that you exhale from leaving beyond the mask and then reducing the chance of infecting another person. It's not a perfect solution, they're not 100% effective, but it is one more thing that we can do to help slow the spread of the novel coronavirus in our Colorado communities. Now, for most of you, this is going to be the first time that you've been asked to wear a mask. So let's talk about the appropriate ways in which to wear the mask. First, what you want to do is remove any glasses, hats, anything else on your head. Grabbing the mask only by the elastic bands or ties, place the mask to cover your mouth and your nose. Secure the mask either behind the ears or behind the head. For the entire time that you're wearing the mask, do not touch the front of the mask nor your eyes. You can put your glasses, hats, other gear back on after you secure the mask. A lot of times glasses may fog while wearing the mask, and I just recommend moving them slightly forward on the nose to try to prevent them from doing that. Now, the current recommendations say that we should wear masks whenever we're in public settings where we cannot maintain a strict 6-foot distance between us and others. The easiest way to follow this guideline, in my opinion, is just to wear a mask or cloth covering whenever you leave the house. What I do is I keep my cloth mask next to my car keys, and whenever I'm going on an essential errand, such as the pharmacy to pick up a prescription or to the grocery store, I then will put on my mask before leaving the house. I will then wear the mask the entire time that I'm gone and running my errand. Whenever I come home, I will take off the mask and go to the sink and wash my mask with soap and water for 20 seconds, followed by washing my hands with soap and water for 20 seconds. I will then hang my mask up to dry by my car keys. Now, I know that not everybody has somebody in their family who can make such a lovely cloth mask. Don't worry, there are a lot of patterns that don't even require sewing to make a cloth covering for your face. We've included links to those patterns in the description of the video below. Now, really quickly, we're just going to review a few quick do's and don'ts with regards to the use of cloth masks. First, do wear your cloth mask whenever you leave the house. Second, don't touch the front of the mask. Do touch the elastic bands or straps that are used to secure the mask. Do maintain a 6-foot distance between yourself and other people the entire time that you're wearing a mask. It's not a perfect solution. It doesn't turn you into a superhero. So please, that physical distancing is still very important. Don't leave your house except for essential errands or for essential work. Do like this video, subscribe to our channel, and leave any questions in the comment section below. Thank you very much, and stay healthy, Colorado.